So, most people, when they think about kidney problems, they picture something quite obvious: pain in the back, blood in the urine, something dramatic that sends them straight to the emergency room. And yes, those things happen. But the reason kidney disease is so dangerous, and the reason it is so common and so frequently missed, is that for most of its course, it produces almost no symptoms at all. Or it produces symptoms so subtle and so easy to dismiss that people ignore them for years and years without a second thought. Your kidneys are two of the hardest working organs in your body. They filter every single drop of blood you have roughly 40 times every day. They regulate your blood pressure. They control how much water stays in your body. They produce a hormone called erythropoietin that tells your bone marrow to make red blood cells. Without enough of that hormone, your body becomes anemic and every cell starts running low on oxygen. Your kidneys also control the balance of minerals like potassium, sodium, and calcium in your blood. Get those minerals out of balance, and your heart rhythm, your muscle function, and your brain all begin to suffer. And here is the frightening part. According to the National Kidney Foundation, 90% of people who have chronic kidney disease right now do not know they have it. 90%. That means millions of people are walking around every day thinking they are fine while their kidneys are quietly losing function. The reason this happens is that the kidneys have enormous reserve capacity. You can lose 50 to 60% of kidney function before your body shows any clear sign that something is wrong. The damage is happening, the numbers are falling, the organs are struggling, but the symptoms are either absent or so vague that most people put them down to being tired, getting older, or just having a stressful week. So, in this video, I am going to go through 8 signs that your kidneys may be in trouble. Some of these are well known, some of them are genuinely surprising, and I want you to pay close attention because catching this early is the difference between slowing the disease down and needing dialysis later. My name is Dr. Favor Ade-Ami. I have over 10 years of clinical experience, and I have seen what this disease does to people who miss these signs for too long. Let us go through all 8. Sign number 1. Your urine looks foamy or bubbly. This is one of the earliest and most important signs that most people completely ignore. When you flush the toilet and you notice foam or bubbles in the water that takes several flushes to clear, that is a sign that protein is leaking from your blood into your urine. Healthy kidneys act as filters that keep large, useful proteins like albumin inside the bloodstream. When the tiny filtering units inside the kidney called glomeruli become damaged, they start allowing protein to pass through into the urine. That protein creates foam the same way egg whites create foam when you whisk them, because albumin, the main protein in urine, is the same protein found in egg whites. This is called proteinuria, and it is one of the most reliable early warning signs of kidney damage. The National Kidney Foundation recommends a simple urine test called the urine albumin to creatinine ratio, or UACR, to check for it. If your urine looks persistently foamy, do not ignore it. Ask your doctor for this test. Sign number 2. Swelling in your feet, ankles, or around your eyes. When your kidneys are not working properly, they cannot remove excess fluid and sodium from your body. That fluid builds up in your tissues and causes swelling, which doctors call edema. The most common places to notice it are your feet and ankles, especially towards the end of the day after you have been on your feet, and around your eyes, especially in the morning when you first wake up. Puffiness around the eyes in the morning is a specific sign that the kidneys are leaking protein, because when protein levels in the blood fall, the body loses the ability to hold fluid inside the blood vessels, and it leaks into surrounding tissue. Swelling can also be caused by heart problems or liver disease, which is why it is important to get it properly investigated rather than just assuming it is normal. If your shoes feel tighter than they used to, if your socks are leaving deep marks on your skin, or if your face looks puffy in the morning, take that seriously and get checked. Sign number 3. You are exhausted in a way that sleep does not fix. This is not ordinary tiredness from a busy week. This is a deep, persistent fatigue that does not improve no matter how much you sleep. When the kidneys are damaged, 2 things happen that cause this. First, waste products and toxins that the kidneys should be removing start building up in the bloodstream. These toxins affect your brain and your muscles, causing a feeling of heaviness, weakness, and difficulty concentrating that people often describe as a fog that will not lift. Second, as kidney function drops, the kidneys produce less erythropoietin. With less of this hormone, the body makes fewer red blood cells, and fewer red blood cells means less oxygen reaching your muscles, your organs, and your brain. This is called renal anemia, and it is one of the most common complications of chronic kidney disease. You feel like you are constantly running on empty because at the cellular level, you are. Many people spend years being treated for depression or burnout when the real cause is undiagnosed kidney disease and the anemia that comes with it. Sign number 4. You are waking up at night to urinate more than usual. Needing to urinate frequently during the night, a condition called nocturia, is a sign that your kidneys are not concentrating urine correctly. Healthy kidneys concentrate urine during the night so that you can sleep without interruption. When kidney function declines, this concentration ability is impaired, and the kidneys produce more dilute urine, which fills the bladder more quickly and wakes you up. Nocturia is commonly dismissed as a bladder problem, a prostate issue in men, or simply part of getting older. And sometimes it is those things. But, combined with other signs on this list, it is a meaningful indicator that the kidneys are not working efficiently. A man or woman who suddenly starts getting up twice or 3 times a night when they previously slept through should not just accept that as normal aging without getting their kidney function checked. Sign number 5. You have persistent itching with no rash. This is the sign most people on this list ignore completely, and it is the one I want you to pay particular attention to. When the kidneys cannot remove waste from the blood effectively, certain minerals, particularly phosphorus, build up to abnormally high levels. Excess phosphorus in the blood deposits in the skin and causes a deep, crawling, irritating itch that has no visible rash and does not respond to moisturizers or antihistamines. This kind of itch is sometimes called uremic pruritus, and it is one of the most distressing and most overlooked symptoms of declining kidney function. Patients describe it as a sensation under the skin that nothing on the surface relieves. It is worse at night. It affects the back, arms, and legs most commonly. People spend months or years treating this with creams, antihistamines, and allergy investigations, when the actual cause is a kidney that can no longer manage mineral balance. If you have unexplained, persistent itching that no skin treatment touches, please ask your doctor to check your kidney function and your phosphorus levels. If you have made it this far, you are clearly invested. You want to see what happens next, but most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Now, I want to take a moment to share something I have been working on, because it connects directly to everything I am teaching you today. Over the years in my clinic, I have seen one simple truth. Real progress does not come from extreme changes. It comes from doing the right small things consistently. That is why I created the 30-day blood pressure reset for seniors. It is a simple, step-by-step plan designed to help you support healthy blood pressure through gentle daily routines, light exercises, and clear guidance you can follow right at home. The connection to kidney health is direct and important. High blood pressure is the second leading cause of kidney failure after diabetes. If your blood pressure is not well managed, it is slowly damaging the blood vessels inside your kidneys every single day. Some of my patients who followed this structure told me they felt more in control of their habits and more confident about their readings. Now, I am keeping this very limited. Only 30 spots are available and 5 are already gone, so just 25 spots left. If you feel like your current routine is not giving you the clarity or results you need, you can click the link in the description or scan the QR code to secure your spot before it fills up. And because you are part of this community, I have made it easier for you with a 70% discount, so you can get started without worrying about the cost. After you get your copy, You can drop your email, and I will personally follow up with you, checking in and helping you stay consistent with the plan. Now, let us continue with the remaining signs. Sign number 6, a metallic taste in your mouth or breath that smells like ammonia. This is a sign that most doctors do not immediately connect to kidney problems, but it is well documented and clinically significant. When kidney function drops low enough, waste products called urea compounds build up in the bloodstream. The body tries to remove some of these through breathing and through saliva. The result is a persistent metallic or ammonia-like taste in the mouth that people often describe as tasting like old coins or chemicals. The breath can take on a similar ammonia odor that brushing your teeth does not fully resolve. This condition is called uremia, and it is a sign that the kidneys are severely overloaded with waste. They can no longer filter fast enough. If you develop this taste and it is persistent, do not assume it is a dental problem or acid reflux. Get a kidney function blood test, specifically a serum creatinine and eGFR, done as soon as possible. Sign number 7, high blood pressure that is hard to control. Most people think of high blood pressure as a cause of kidney disease, and it absolutely is, but damaged kidneys also cause high blood pressure, which creates a cycle that accelerates damage in both directions. Your kidneys regulate blood pressure through two main mechanisms. They control how much sodium and fluid stays in the body, and they produce a hormone system called the renin-angiotensin-aldosterone system that tightens or relaxes blood vessels. When the kidneys are damaged, both of these systems go wrong simultaneously. The kidneys hold on to too much sodium and fluid, raising blood pressure, and they release too much of the hormones that constrict blood vessels, raising it further. The result is blood pressure that is difficult to control, even with medication. If your blood pressure has suddenly become harder to manage than it used to be, or if you are on multiple blood pressure medications and your readings are still not at target, kidney disease should be investigated as a contributing cause. A simple blood and urine test can reveal whether the kidneys are part of the problem. Sign number 8, trouble sleeping, muscle cramps, or restless legs at night. Sleep problems in kidney disease are caused by several overlapping mechanisms, and together they form one of the most recognizable but least understood patterns in early kidney disease. First, the buildup of toxins in the blood affects the brain and nervous system in a way that disrupts the normal sleep cycle, making it difficult to fall asleep or stay asleep. Second, declining kidney function alters the balance of electrolytes, particularly calcium, potassium, and magnesium in the blood. These imbalances cause muscle cramps, particularly in the calves at night, that wake people repeatedly. Third, anemia from reduced erythropoietin production is one of the recognized triggers for restless leg syndrome, a condition where the legs develop an uncontrollable urge to move, particularly when you lie still. Research confirms that kidney disease is significantly more common in people with restless leg syndrome than in the general population. If you are experiencing muscle cramps at night, or legs that will not stay still, or sleep that feels disturbed and unrefreshing without a clear reason, consider asking your doctor to include kidney function tests in your next blood work. Now, let me bring this together clearly. 8 signs. Not all of them will be present at once, and not all of them indicate kidney disease in every person. Other conditions can cause many of these symptoms. That is exactly why you need a doctor to evaluate you properly with blood and urine tests, rather than trying to diagnose yourself. The two most important tests for kidney function are the eGFR, which is a blood test that estimates how well your kidneys are filtering, and the UACR, which is a urine test that checks for protein leaking from the kidneys. Together, these two tests can detect kidney disease in its early stages, before symptoms become severe, and before the disease has progressed to a point where recovery is difficult. According to the 2024 KDIGO clinical guidelines, both tests should be performed together because neither test alone catches all cases. If you are over 60, if you have diabetes, if you have high blood pressure, if you have heart disease, or if kidney disease runs in your family, ask your doctor to run both tests annually. You should not wait for symptoms to develop. By the time symptoms are clear, significant damage may already have occurred. The 8 signs to watch for are foamy urine, swelling in the feet, ankles, or around the eyes, persistent fatigue that sleep does not resolve, waking at night to urinate more than usual, persistent itching with no rash, metallic taste or ammonia breath, high blood pressure that is difficult to control, and sleep problems with muscle cramps or restless legs. If you are experiencing 2 or more of these consistently, please do not wait. Get tested. Before you go, think about this for a moment. Most people keep waiting for the perfect time to take their health seriously, but that moment usually never comes. That is exactly why I created the 30-day blood pressure reset for seniors. It is designed to help you follow a simple, structured daily routine that supports healthy blood pressure without confusion or stress. Inside, you will find gentle exercises, practical daily habits, and a clear plan you can follow step by step. I have seen people in my care feel more confident and in control just by sticking to something structured like this. Now, I am keeping this very limited. Only 30 spots are available, and 5 are already gone, so just 25 spots left. Once those spots are filled, I will be closing it. If you are ready to start something simple, click the link in the description or scan the QR code to secure your spot now. And because you are part of this community, I have made it easier for you with a 70% discount, so you can get started without worrying about the cost. After you get your copy, you can drop your email and I will personally follow up with you, checking in and helping you stay consistent with the plan. Disclaimer: everything shared in this video is general educational information based on published clinical guidelines, peer-reviewed nephrology research, and data from the National Kidney Foundation, the American Kidney Fund, and the 2024 KDIGO Clinical Practice Guidelines. It is not personal medical advice for your individual situation. If you are experiencing any of the symptoms described, please speak with your own doctor who can examine you and order appropriate tests. This video is a starting point for that conversation, not a replacement for it.